I'm Dr. George Anterasian. Today we're going to do the Eyes by Thermage procedure on Marty. The eyelid thermage is a good procedure for patients who have mild to moderate laxity of the upper eyelids, which you can see here, and, open your eyes a little wider, have some crinkling and laxity of the lower eyelids. The procedure works by introducing into the skin radiofrequency energy. That energy is converted to heat, and the heating action produces two beneficial results. First, it tightens the existing collagen, and second, it stimulates new collagen production. That new collagen comes out over the next 4 to 5 months. So with an eyelid thermage, there will be some immediate tightening of the upper and lower eyelids. And then over the next 4 or 5 months, as the new collagen is laid down, there'll be an additional improvement in the tautness of the tissues and a reduction in the laxity of the tissues. Patients who have had eyelid thermage report that their eyelids are more open, the upper eyelids are tighter, and their skin is less crinkly. So we'll get started. We're going to begin by putting a treatment grid on the upper eyelid. This goes down like a temporary tattoo. And it helps to keep the treatment very organized and ensures a uniform treatment is given. We've put an eye shield into Marty's left eye, and the purpose of the eye shield is to protect the eye during the eyelid thermage procedure. We'll remove the eye shield at the end of the procedure. We put a coupling fluid on the skin, and this liquid is used to enhance the penetration of the thermage energy into the skin. We're going to begin Marty's treatment with her upper eyelid using the small 1/4 centimeter tip to give a series of thermage pulses to the tissues. Here we go. Doing good?
Yeah.
The key to thermage is to make multiple passes over the tissues at energy levels that the patients find easy to tolerate. That gives a much better result than going over the tissues only one time at too intense an energy level. So the key is multiple passes at easily tolerated energy levels. Okay, we're going to start the second pass on Marty. We lay down these series of pulses very close to each other, very uniformly and very evenly. And we're finishing our 5th and final pass on Marty's eyelid. We finished the thermage treatment on the eyelid itself. Now we are going to treat the tissues around the eye. The purpose of this is to tighten up the tissues of the lower eyelid and to reduce some of the crinkling and crow's feet on the side of the eye, as well as to additionally tighten the upper eyelid. We're going to make multiple passes in this arc around the eye. That's one pass around the eye. Again, we're going to make multiple passes. As you can see, we've changed the treatment tip. The treatment tip is much larger because we're treating a much larger area. That finishes the second pass. We'll make additional passes now. We want to do a total of at least 5 passes. Again, using energy levels that Marty finds easy to tolerate. So we finished 5 passes of the tissues around the eye, and this completes the eyelid thermage on Marty's left eye. We're now going to remove the eye shield from the left eye and perform the identical procedure on her right eye. Again, we're going to make multiple passes over these tissues, which is the key to the Thermage treatment. Marty, are you comfortable?
Yes.
What are you feeling?
Heat and like little snaps, but it's very tolerable.
So it's easy to tolerate?
Yes.
Yeah. So we finished the eyelid thermage. We've removed the eye shield. We've cleaned off the treatment grid from the 2 upper eyelids, and we're all done. And we're going to set Marty up, and then we'll ask her how the procedure went.